Loud. All right, so it is 10 o'clock on the dot. We have 29 people in the room so far, which July is usually a slower month for attendance, which is luckily why we always go ahead and record everything. So people who are still on vacation can go ahead and see what we have. So I have two very wonderful women who filled in at the last minute for me. It was so difficult to get a speaker for July. So we're going to have Cheryl Beseler talk to us about farm response and update us on everything. And then Linda has some really great information about attending the Pork Expo and a lot of things that she learned there, and then some mental health information, right? Linda, is that what Tara told me? Okay. All right. So we're going to go ahead and let Cheryl share her screen, and then she's going to go ahead and give us some updates on farm response.
Okay.
Looks good.
I think everyone can hear me, right? I'm good?
Yep.
All right. Well, first, my name is Cheryl Beseler. I'm the evaluator for CS CASH, the Central States Center for Agricultural Safety and Health. And we have been helping with farm response as part of our grant project and part of our 5-year plan in the next cycle for the NIOSH funded egg centers. So I'm really excited about farm response because I think it's really needed in our rural communities. AgriSafe provides professional development training for healthcare professionals in your state and every state to improve agricultural mental health care. And Farm Response is a 3.5-hour continuing education module developed by national experts from AgriStress Response Network. AgriSafe's Farm Response course addresses farm and ranching, cultural competencies, financial stress, land ownership and legacy issues, and the work of agriculture. Darn. Okay, there we go. And then Farm Response also is helping online workers, hotline workers who are addressing people who are calling into the hotline who are stressed. And the on-demand course was developed in Articulate, and it's an award-winning interactive virtual training product. And it meets the needs of all the e-learners. And we had very few complaints, so it worked really well in our training program. And let's see, what else do you need to know? Oh, we give continuing education credits for nursing, social work, occupational therapy, physical therapy, audiology, physicians, physician's assistants, industrial hygiene, certified public health professionals, certified safety professionals, and we have through distinct CE providers that we have arrangements with. Let's see, and we have censored the learning format so that it meets the standards of professional development, training, objectives, and required pre-test, post-testing. So that's the basic background on this. We know that healthcare providers benefit from knowing how to start conversations with farmers and ranchers about stress and behavioral health. And if they're not acquainted with life in the agricultural rural community, they often do not know how to begin those conversations. And as we all know, getting farmers to talk can be a real challenge. So this is designed to help them open up those conversations. So providers moving into rural areas, or even those on telehealth, are not always equipped to manage the unique stressors and particularly the injury risks associated with doing agricultural work. This was launched in February of 2022. And like I said, is an on-demand interactive program through AgriSafe's Learning Lab. The Farm Response course covers all the things that I talked about. And it's based primarily on the total farmer health model. So now I'm going to go into some of the methods. Recruitment was really important for us because, well, since CS CASH was funding it, we really wanted to reach out to the 7 states in our region and then beyond, of course, into every state and even internationally. So we were targeting commodity groups, ag businesses, rural healthcare, nurse associations, social worker associations, audiology and speech pathology, VA clinicians, certified safety professionals, industrial hygienists, and physical therapists. And not in this, of course, are the hotline workers that also benefit from this training. Process evaluation focused on who was enrolling, who was being reached, who was completing the modules, and how the education platform was performing for our participants, especially rural areas where Wi-Fi can be spotty at best. Test question quality was conducted on the pre-test questions. And we looked at just how things had changed using paired t-tests between pre-test and post-test. And we also were interested in what the correlation was between pre-test and post-test scores, because we want to know if people came into it, was a good predictor of the post-test just doing well on the pre-test. And so what was the connection between people coming in and what they had come out with after the training? We also looked at the quality of the questions. I'm going to show you some of that data. And then we've done some qualitative interviews, which we will follow up with later to report on. So for the evaluation, we were using the REAIM framework, which I'm using at CS Cash because I love this framework. So what's really important about REAIM is really understanding who your target population is and how to reach them. And then, of course, measuring effectiveness, and that's where we are. We're still kind of moving towards the adoption phase. We haven't really gotten there yet, but I am going to show you results saying that this program is effective. And we also need to keep working on who we're reaching. So this is just an overview of what the questions look like. There were 20 questions pre-test. The same questions were asked post-test. In the pre-test, they took it once. In the post-test, you could take it as many times as you wanted to. If you make errors, you can go back and restudy the material and try again. So we used the first post-test for comparison purposes. Otherwise, it'd be really hard to figure out like, which ones we should use, and it wouldn't be a clean analysis. So this gives you an idea of what the questions look like, and they were mostly multiple choice. Things like what percentage of U.S. farms are small family farms? We know that that's really high in the 90s, like 90%. Which statement about agricultural production business is true? So there's some true and false and multiple choice. And that was both the pre and the post. And then here's the second set of 10 questions. So you can get an idea of what these things look like. They were kind of specific, and there were some people saying that, well, we shouldn't have to know numbers, but there are very few questions that actually asked about numbers, and we think that the ones we use were important. So here's just a diagram of what kind of correct answers we saw at pre-test, the range. And it's hard to see this bar here, but we did have a good range of really, questions that everyone got right and questions that maybe half or fewer than half of the population that taking the test got right. In terms of the quality of the test, this has turned out to be pretty, I was very satisfied with this. I thought it was a really good job for a first pass at a test, because if you look at the difficulty, you can just see, like from going from low difficulty to high difficulty, that we had a nice range of level of difficulty on this exam. And then that kind of just tells you how hard the questions are for whom. And the discrimination is a nice measure too, because it tells you what people who don't know a lot, it distinguishes people who don't know a lot from people who do know a lot. So you can kind of discriminate between who has knowledge and who does not have knowledge based on that test question. So I was pretty happy with this too. It's not as good as the difficulty, but we still have a pretty good range. So the overview of the quantitative results, then looking at the results from pre-test to post-test and giving a summary of our sample. So we had participants from 35 US states representing healthcare systems, federal and state governments, counseling centers, academia, insurance companies, and healthcare providers in private practice. I was surprised to look at how many people were taking it who are not actually in healthcare. Some of the people that were taking it taught people who would go into healthcare, especially in rural areas, but there were people taking it in other areas just to learn more about agriculture and the challenges that come with working in an agricultural world. So, and then the disappointment too we had is that not everyone answered the question about whether they were working in a rural area. We only had 158 who responded to this question, and 118 of them replied that they did work in a rural area. So it was a skewed distribution, so I'm reporting the medians here, but at pre-test, the median was 12, and at post-test, it was 17. But you can see the range from 3 to 19 to 16 to 20. So not only did they do better, but that range really tightened around that median. So pre-test scores were not correlated to post-test scores. It was a pretty low row at 0.19, not significant, which is interesting too, because it means that the best predictor of your post-test score is not necessarily your pre-test score. So that's informative. And then participants completed the modules in an average of 19.3 days with a huge standard deviation of 38.4. And some people thought it took too long to complete. What we don't know is how much time they actually spent doing it and then it depends too on what your background is and how much you know going in. So the classical test theory methods we used showed that there were no easy items. 15 items were moderately difficult and 5 items were difficult. So that's kind of where we want it to be. We don't want too many easy items. We didn't have any actually, and moderately to difficult is really good. And so all items scored in the acceptable range for discrimination and the ability to distinguish those with more knowledge from those with lesser knowledge, which is desirable. So this is just a graphic summary of our results. The column that says 5.05 on the far left, the turquoise kind of color, that's the mean difference between the scores, and you can see the error bars there. And then the pre-test is the 12.3 with the error bars, and then the post-test is the 17.3. And you can see that the error bars don't overlap, so it was statistically significant. But you can just see that improvement. And then we asked some questions about overall, like, how do you feel about the content? So we asked, was the level of the content, the level of difficulty appropriate? And 95.7% felt like it was an appropriate level of content. And we had 12 that felt it was too hard and 12 that thought it was too easy. And then when we asked, how difficult would it be for you to implement changes in your communication and referrals in your practice? This one was really interesting too, because overwhelmingly they said, I can do this. Like very easy, 20.8% said very easy, and 56.3% said easy. And there are very few who actually, were applied to them because they worked in that in the field, said that it would be difficult or were neutral. So, but like I said, there were a number of people, 17.4% that said this would not apply to them, so that they didn't have an opportunity to actually use this material. So application to the field. Understanding the stresses and culture in which stressors are experienced in the agriculture community is critical to understanding farmers and ranching and to have those conversations about stress and the impacts of stress on their lives. We can improve understanding by building trust, building relationships, like showing farmers that we understand what they're going through, which is really, really critical to opening up those dialogues. The farm response curriculum is primarily attracting those in counseling and medicine who interact with patients in their practices and clinics. But mostly there's a large chunk of them though that are not doing that, who just really benefit from this for other reasons. And we're not quite sure exactly why or what they're doing with that information. In order to improve the current evaluation, I think there's more work that can be done, like some of the test questions can maybe be improved. But then reaching out to those people we are really trying to reach, and we're working on that to get maybe more people in the rural communities, understanding what rural communities, they're coming from, because we have their state information, we know where they're working, but just get a better feel for like how many of those people who aren't responding to the rural question, what they're actually doing with the material. And then, so yeah, we need to do additional work to understand the quality of the questions and maybe improve some of the questions and address some of the comments. But for overwhelmingly, the comments were very positive. People always said it was very informative and they learned a lot from doing this. Okay, so what's next? This is the exciting part. A provider directory. They're currently working on a provider directory, and this provider directory will give a listing of all the people who are available in the areas where our farmers and ranchers live, who can reach out to them, because one of the things we saw is that they want to use this material and they want to connect with farmers and ranchers, but they just don't know how. And I think the same thing as the farmers and ranchers, they don't really know where to go. So I'm thinking that the directory will be a really nice follow-up to having those services already available out there, but we just need to keep training more people about rural stresses and rural mental health. So the directory will be featured on the website. It will be searchable by zip code and state. The directory will feature the provider's credentials, practice specialty, types of services, and contact for those interested in making an appointment with them. The directory will be searchable by the public, as well as our AgriStress helpline staff, to help connect people to the care they need, and there is no charge for this. So to improve our course here, we are working on shortening the training to make it match better with the reported completion times from participants. Because there are a number of people said it took them like 6 hours to finish this. That was the basic number we saw. This took 6 hours, not 3.5 hours. So we're working on that part. And then we hope to reach out to other industries, other partners to further promote this training, because we have seen that it really does work. And we need to get a better handle on how it's being used in the community and more follow-up interviews. And of course, we want to thank CS Cash and NIOSH for providing the funding for this. And I'm willing to take any questions anyone might have.
Cheryl, I don't have a question, but a few little notes to add on. So as Cheryl mentioned, this was a project vetted in part by the Central State Center of Agricultural Safety and Health. So their region, which is a southern part of it would be Missouri and Kansas, and then it trails up 7 states to the Canadian border. There are free seats that were sponsored or through a generous grant from CS Cash, healthcare providers and pastoral society, different associations could qualify, and to get a free seat, all they have to do is go to our website and look for the Farm Response Project. And then from there, it's a very short application, and then they have their free seat. So I saw some folks on from Kansas and Nebraska, of course. So I had to put that plug in there. And as I am a nurse and a clinical provider, so definitely I see the benefit of even those healthcare clinicians that come out to our rural communities. So specialists truly do not have an understanding of what it is like to live and work in agriculture. And so having those folks educated definitely will make a difference. I just had this conversation with a nurse practitioner that I saw a couple of months ago. She did something as simple as had a calendar, a farm calendar in the clinic room that had pictures of agriculture. And I brought that up to her. She said, I don't really understand agriculture, but someone offered it to me, and she thought, maybe this would be a way to lead into a conversation with the farmer to help establish that trust. So, very simple thing that she did. However, it may definitely open up a conversation with a producer and the related stresses they may be going through.
I agree. If you have never taken Farm Response, I would highly recommend it. Somebody wanted the website, so I'll go ahead and post that in chat. It's the Farm Response is directly on the AgriSafe website. Cheryl, there's a few questions in the chat. How do you join the provider list? Is AgriSafe the ones going out and getting the providers, or are there any providers coming to us?
I think AgriSafe has been, but maybe Linda knows more about this than I do. I think AgriSafe has been putting together the list, and I'm not sure how many people have contacted AgriSafe to be added to the list. Linda, do you know anything more about that?
Yeah, Angela, our web librarian, has been putting that list together. So she's the one that's making the connection. So if there's someone that has a direct interest, they can email either Carrie or myself. Carrie can be a nice little vector to get us your information, and we'll get you in contact with Angela if they're interested.
Yes. And Alina asked, did we provide this questionnaire in Spanish to anyone?
No, we have not done that yet. I think it's in the plan to do so. Okay.
And then Karen Stolman wants to know, if we had people take it early, when would the training be different? Is it going to be shortened? Will it be enough for them to take again?
I'm not sure about that. I'm not sure we're going to shorten it a whole lot. I'm not sure exactly what the plan is to shorten it. So I don't think that you need to take it again, though. It's going to be pretty much the same material built on the total farmer health model. So
okay,
yeah,
just not take as long. Because I'm thinking when I took it, it was almost 5 hours for me.
Yeah, it's not 3.5.
Yeah. If you do it correctly, yeah, it's longer.
Right.
Kathy Walker wanted to know, has the AgriSafe, the Farm Response, partner with any rural health associations?
I believe that they have. I believe we do have associations with rural health associations, but I'm not sure what they are.
So yeah, I feel like there's a nurses one, right? Rural nurses.
Yeah, rural nurses is one.
Yeah. So we're working towards that. That it takes folks a little bit of a little bit of a challenge, not a challenge, but they just have to kind of look into it and have a good understanding before they're willing to promote it. So there are some states, and of course, Tara can speak much more in depth than I can about this, but there are some states, particularly Texas, jumped on it, and they had within a couple of days, over 500 folks respond that they were interested in taking it. So it's just finding that right stakeholder that can help push it out to the masses. That's been the key to pushing this out.
Yeah, a lot of our respondents were from Texas and Pennsylvania. It was amazing.
Pennsylvania.
Yeah. How many were from those two states?
Right. So it's just trying to get in front of the right folks at the right time to get it pushed out.
Those 20 questions that you had up there, Cheryl, in the chat, they want to know, do we have those posted anywhere? Or is that just out for our information?
Yeah, that's for your information, because I don't think we'll be changing all of the questions. So we don't really want the test results to be out there.
Yeah.
The test questions to be out there.
Questions, right. And then Linda, you might have to answer this. The funding that we have for farm response, it's not every state, right? It's
Correct.
State.
Correct. Yeah.
Okay.
So either SDAs have funded seats or like CS Cash has funded seats. And so there is a map on our website that will show you, it highlights those states that are have funding.
Yeah.
So if you are in a state that doesn't have funding, try to get with your state Department of Ag to get with AgriSafe, and then we can hopefully get some seats in that state.
Mm-hmm.
Yeah, we could definitely use more people from our 7-state region of North Dakota, South Dakota, Nebraska, Missouri, Kansas. More people from these 7
Minnesota.
states.
The other
Minnesota,
one, yeah.
yes, Minnesota.
Yes.
Yeah.
Now, Trish, she is fantastic at helping us. She said she can provide information about how Texas got so many to take farm response, and then they have further plans for outreach. So, I mean, if you want to unmute and tell us, like, give us just a quick recap, Trish, and then maybe we can have you come back on later once you've gotten all the further outreach, and maybe give your own presentation. That would be perfect.
That'd be great. So here in Texas, we have an overarching Behavioral Health Executive Council, which is over all the licensing boards for social workers, psychologists, licensed clinical practitioners. They had a mailing list of 70,000 licensed practitioners in the state of Texas. So it went out to all of them. And we had at least 1,600 people respond to get the code to take the training for free. And we trained over 271 licensed mental health professionals in Texas. So we were really fortunate to have that group to be, to send that email list and be able to partner with us on that, which was awesome. We're actually for year 3, we're coming up on year 3, September 1. We're looking at maybe try to work with maybe a small group of clergy, because that is often the first place that folks go to. Potentially also ag teachers, youth. We really want to reach the youth market, and FFA and 4-H. So we have other opportunities, I think, that really large groups of people. We also I'm with the State Office of Rural Health, so looking at hospitals, clinics. We have connections with all of them. And let's see, I think that's for the most part what we're looking at right now. There are some other ideas down the pike, so we'll see what happens within the next year 3. So we were excited to get that many people. And AgriStress Network has been a great project.
Okay. Yes, it has, Trish. And I vividly remember the staff was like, hold on to your hats, people. Trish got us a ton.
You set the bar high, Texas. You really did.
Definitely.
We're just so pleased to be able to get this many people trained in farm response. And we also have our county extension agents out there, and we have our livestock and produce safety staff. We have a lot of other areas of opportunity, I think, for farm response. So we'll see what the future holds.
You're providing a model for the rest of us, Trish.
Well, if you can find those licensing bodies, even if you don't have an overarching council, if you have individual licensing bodies that you can go to, definitely work with them as much as you can. Because we have people that are licensed in Texas, but that don't live in Texas. And so we've even gotten a few of those folks in. For the database, all of those people that have been trained in farm response will have the opportunity to be on that database, that searchable database.
Melissa had a question in the chat. So how can those who are on this call help promote the training in the areas that AgriSafe is most interested in? She wanted to know, is there a social media post or in an email they can send out to their contacts? I know for some, when my mouse starts working, I will go ahead and post the farm response link to our webpage on AgriSafe. It has all the definitions, all the states that are funded, but I'm not sure about like what kind of email is Cheryl or Linda, is that something that you would need to get with Melissa personally to say, here's the email draft that we sent out, you can change it to your what you
Tara,
need?
yeah, Tara has kind of a template that definitely we could share out to help push out farm response. And of course, I always personally think that if you take the course yourself, you are the best advocate. So if some of these folks haven't taken the course and you're in a free funded state, please do take it. And then you can also speak well, speak intelligently about the course. And then if you have contacts within the licensing boards, as Trish had talked about, that would be wonderful. Sometimes it's just taking the time to sift through, those websites to find that right person to connect with the project itself. That is always very helpful. So, if Melissa, if you've got some folks that there in your state, that might be helpful.
Yeah.
So
And then,
Carrie, I have a question for you. I signed up for it and I got the grant to do it, but
Okay.
expired within 30 days. And I apologize, I didn't get it in right away. Is there anything I can do about that?
Linda, do you know for sure?
Yeah, that would be a great question for Tara. Again, she can maybe work whatever she has to work. What state are you in, Tammy?
Nebraska.
Oh, well,
You get
then
it for free.
that should be, you should be able, did you try? You might have to sign up again. I don't know if you have issues, let me know. I'll connect you with Quace, who really handles a lot of our IT issues, but you should be able to take that easily.
That's what I was thinking,
Okay.
since it's already free. Yeah. And I put Tara Haskins, our farm response director, her email in the chat for anybody who would like to contact her about that. And then Cheryl, we have one more question from Amy. Are compact state licenses for RNs considered for the scholarship states? She's in North Carolina, but compact license covers some of the scholarship in the states. I have
no idea.
Yeah, that's a nursing licensing thing. I don't think so. That's a good question for Tara. I don't think so, because it's more state funded versus a compact license. So I know that's come up with Tara before. That's where we need Tara's insight on that.
We do.
Okay, so I need to make a note of that and maybe send
That's
that
a Tara question.
Okay. All right. I'm going to write that down because I don't know what that means and that I won't remember that. Okay. All right. If you do have any other questions that come up, we'll go ahead and have Cheryl put her email in the chat. We'll also send it out in the email afterwards with the link to the meeting. And next up, we're going to have our own list, Linda Emanuel, that is going to share with us some wonderful insights that she has had over the past, it's just been 30 days. Is Pork Expo longer than 30 days ago?
No, less than.
Yeah.
Yeah.
Okay. All right.
Still
We'll
recovering.
start sharing your screen, and then we're going to be excited to hear what you have to share.
I am going to talk here for just a little bit, and then I'll start sharing my screen. Real quick, Carrie, if you could send Tammy Quace's email, she can connect directly with him for that IT question she had about the farm response and getting her onboarded again. So thank you for having me this morning. I had a unique opportunity in early June to partner with the Commodity Association, and specifically it was the National Pork Board, the pork checkoff folks. We were invited, AgriSafe was asked to be part of the World Pork Expo that's held annually in, of course, of all states, Iowa, because they are a high pork producing state. Backing up just a little bit, for those of you that don't know me, I am the Community Health Director for AgriSafe, as well as a registered nurse working here in Nebraska. So you have 2 Nebraska girls with you this morning. We are producers here. I am part of a 3-generational family farm. My husband and I are row crop farmers. We welcome back our sons into the operation, and my 85-year-old father-in-law this month is part of our operation, and we also have cow-calf herd on the side. I did grow up in hogs. My folks ran a large farrow to finish operation, but after I left for college, I didn't go back to the hog barn. And so it was truly a unique opportunity to be working alongside of the pork board folks and meeting tons of producers, thousands of producers from the globe. So World Pork Expo is a 3-day trade show, really, where various folks from industry, lots of engineers and feed and specialists and veterinarians from all over the world come together for 3 days, and they study about innovation and technology and everything that's is needed for that producer to be successful. And one of the great benefits was we got to eat pork for 3 days for free. That was something brand new to me, that they had different little pork dishes that everyone could sample and trial. So it was very much a unique collaboration. So I worked closely with Dr. Heather Fowler, who is a director. She, along with many other credentials behind her name, is a vet and is a firm believer in the One Health concept. And as she commonly put it, she said, we truly support and believe in pigs, people, and planet. So her take was, well, first of all, the stress that our pork producers are experiencing right now is ginormous. The pork commodity prices have really plummeted, where a lot of producers are losing money, sometimes like $50 a hog. The market, as they say, is correcting itself. There was a big influx of hogs at one time. And so now, because the way the market is saturated, the prices have come down. So that is a huge stressor. Another stressor for these pork producers is Proposition 12, that was upheld and is now in California, where it bans sale of pork from producers who don't have specific amount of space for their hogs that are in gestation or farrowing. And so that means these producers are going to have to change a lot of logistics within their barn, which is very, very expensive, of course. And a huge stressor on the horizon that they're very, very concerned about, and this has been going on for a couple of years, but it seems as they're tracing it across the globe, is getting closer and closer to the United States, and that's African swine fever. So African swine fever is a hemorrhagic virus that is a high mortality rate in hogs, whereas I was reading somewhere it killed like half of China's hogs. So it's when a farmer, but if that would happen, where that virus would integrate into their herd, they would not only have to kill that hog, they'd have to kill off their entire herd. So for some of these producers, it's thousands and thousands of pigs on that farm site. And I cannot imagine the stress of a producer having to depopulate his entire herd when some of these animals are healthy, in the amount of money and time that they have invested thus far into that species, into that animal, and then have to kill it, pull it out of that barn, and then have to deal with the carcasses. It's stress beyond. So they had asked AgriSafe with our mental health resources to come on board at World Pork Expo, and I got to work alongside of the Pork Checkoff folks at their booth. And their primary goal, their primary objective of being there was to educate producers on African swine fever and the traceability. So Pork Checkoff is doing their own thing and using technology to trace this virus as it moves across the globe and eventually will permeate into the United States. They don't say a matter of if, it's when. And they're hoping that they would be able to contain this virus within 3 years versus 10 years of a virus that could really be just very traumatizing to the whole industry. So I was brought along to talk about mental health and wellness, and part of getting ready for this was that we developed a resource that was somewhat of a spin-off of our depopulation resource for avian influenza. And so we tweaked it along with the help of the National Pork Checkoff folks, Nebraska Veterinary Association, and CS Cash, as well as AgriSafe, and developed this resource that I will share my screen. There we go. Hopefully you can see that, Carrie. Yep, good. So we wanted to make sure that, of course, the images were correct, that would connect with the producer. And the wording was very, very important. I was very impressed with Pork Checkoff, how they truly do care about their producers and are very careful on how things are worded and to keep the verbiage so that it's at an understandable level for all producers. So they talked a lot about, the different diseases that are out there and how it can impact you as a producer. And while it's important that they take care of their hogs, it's also important that they take care of themselves. So of course, we talked about the impact on farmers, and then the resources, right? These are, and like, how does stress look like within you? And knowing that a large part of the population, when you think about farmers, are males. And so how they cope, interpret stress is going to be different than females. We tried to cover all of the signs and symptoms of depression, and of course, know when to seek help, and then knowing who to contact. We also put in there some very easy, tangible things that they can do, take care of your physical health first, of course, and then incorporate those healthy habits into your life, and then some simple techniques for relaxation, which during a time of crisis is very difficult. But our hope was that in sharing this with producers as well as their families, everybody is more accountable and can help that producer to work through the process. Part of this resource was integrating the animal depopulation resiliency check-in tool that was put together by Dr. Elizabeth Strand. It's a fairly easy check-in tool. By scanning the QR code, it leads you to 5 questions that helps to open up conversations and carry on conversations when it comes to animal depopulation. And it's easy for producers in that moment of high level stress, doing things that are so difficult, to focus on the negative. And so these 5 questions really, it leads producers along the lines, like some things that may be more positive, some things that may have happened along the way that you can focus on instead of just that sole focus on the negative. And then of course, other resources was QPR for farmers and farm families, and disaster distress, suicide prevention hotlines, and such. So this is free. It's on our website under mental health. And so when I was working Pork Checkoff at the World Pork Expo, we put together a kit of papers for the producers. Of course, they come there for the free stuff, as we all know these people that attend farm shows do, right? They want to know what you have for free. And the Pork Checkoff had some lovely little gifts that they gave their producers. But we also included the AgView, which is a traceability platform that Pork Checkoff is using to trace where this disease moves, along with other resources that Pork Checkoff offers. And then we were slipping in the foreign animal disease resource. What I learned through that whole experience, of course, that there is stress out there. Some people are more easily will share once you've established a trust with them, opened up a conversation. And of course, I'm a stranger to them, but there is a little bit of a tact that you have to use when you're starting a conversation with the producer about their mental health. And some folks were very easy to share, and some were not. I heard stories about suicide. Every day I heard of one farmer sharing a story about suicide within their community, within a family member or a neighbor. I learned about farmers, what their worries are. Of course, a lot of it is the financial side. Would their farm be able to survive, their operation survive if this swine fever would happen? As well as young producers who, they're juggling family stresses and farming stresses, community stresses, all of that. But they're worried too about the finances. If they're custom feeding hogs, will I get paid for all the money that I've invested within this herd? It was interesting to me as well during that experience to watch Pork Checkoff folks, because the booth was manned by 6 to 8 folks a day, and some were national veterinarians, some were actually the Pork Checkoff folks who work in communications, all different aspects of Checkoff, and some of them were comfortable in talking about mental health and wellness, and many were not. And so I'm working with Dr. Heather Fowler on this to have a webinar with their Pork Checkoff folks, because they can be our advocates as they're going out and educating pork producers, swine, veterinarians, whoever it is. I want them to feel comfortable to share what we have for resources. I was also very, get rid of that there, hold on, impressed how Pork Checkoff is willing to step right into talking about mental health within their website. So there we go. You should be able to see the Pork Checkoff website there, Carrie. Yep, good. So they have a whole page that's dedicated to mental health awareness. And in easy, simple verbiage, you know, pork producers do not have time nor the want to read through lots of stuff when it comes to mental health. So it talks about, you know, how do you tap into your communities, how you can help one another, because of course there is some gratitude, some fulfillment that goes when you help someone else, some tips for coping with stress and anxiety, and then who do you turn to when you need help. And then here, they have 3 tabs using the resources around them. AgriSafe, we have, this connects to our page that has all of our downloadable documents, as well as our webinars, our resource library, the Suicide and Crisis Hotline, and then Farm State of Mind, which is part of American Farm Bureau's work, their platform on mental health. So that was very exciting to me to have a commodity association to tap into those resources and to address it right up front. They know the most important tool for them is the producer, and that was really part of their whole objective of being there is the producers matter and how can we help you. So going back to that depopulation resource, if I could get this out of the way, it would sure help without having to stop sharing. I want to share with you our webinar that's coming up this month that talks more about that animal depopulation check-in resiliency toolkit that I talked about by Dr. Elizabeth Strand. She is a licensed social worker, as well as a professor, works with the University of Tennessee. And she has studied in depth about mindfulness-based stress reduction strategies, conflict resolution. And she is our expert that I am truly excited to learn more about how this depopulation resiliency check-in tool came about, and then how to employ it with the people that you work with. This webinar is scheduled for July 13th. If you haven't signed up, I do encourage you to. She talks about interpersonal neurobiology, which I'm all about learning more about. How can we help ourselves and as well as help those folks that we work with around us. She'll talk about trauma-related symptoms and the traumatic events that can affect us for a long period of time. So free webinar, you're certainly welcome to sign up. If you can't attend that day, of course, it's always available on demand. So that was definitely something new for me. I've been with AgriSafe for a little over 5 years. And it really was a pleasure to work alongside of a commodity association who really, truly understands what One Health is about and how to help our producers to be more healthy and really tap into their mental well-being.
Linda, does that flyer that you were just sharing there, does it have a QR code that you could?
Yeah, do you want me to go back?
Enlarge? I was just trying to find it on the website and I'm not finding it right away, but I thought, boy, if they're there and they can just put their phone up there.
Certainly.
And then I'll try to find that and put that in the chat as well.
It's also on our homepage for at AgriSafe's website. They'll find it on our calendar.
Okay, and we have. Okay, so David, I don't know if you're going to know this, Linda, from being at the Pork Expo. What is the current price of pork as a reference? Did they discuss that at all? Do you know?
You know, those prices go so up and down so much that we don't raise hogs, so I don't pay attention to it. What I keep hearing though from the industry at large is that prices are definitely low, where, yeah.
Which is the exact opposite of cattle right now, because right now,
right,
sky high.
Yes, exactly. And it's a volatility of the markets, you know, you just don't know. From day to day, it's changing so quickly.
Abby put a plethora of resources in the chat. It looks like she has all kinds of things, animal depopulation, check-in tool in English and Spanish. And then there's also a check-in tool worksheet, which is in English and Spanish. So click on those links so that you can save those for later. Those would be very great. And she put her information in there as well, of who she works with. Thank you so much for that, Abby.
Awesome. Awesome.
Yeah. And then Anitra says, I sure would hope farmers would get support in the event of the swine virus, like other businesses did during COVID. I'm not sure like what FSA, you know, one of those USDA would have any programs like that right now.
You know, go ahead.
I was gonna say, I don't think they probably have anything out yet. Maybe they're in the works of preparing for it, but it probably definitely won't roll out until it actually hits here.
There was chatter when I was at the Pork Expo. Dr. Fowler would love to have the AgriStress helpline available nationally. Right now, it's in specific states that have funded it. So I know there was conversations happening with USDA about the need for this AgriStress, for the helpline specifically for producers.
Yeah. Cheryl has a great point, which I know I brought up a couple times. She says it seems like veterinarians are the perfect group to reach out to because they have empathy about animal welfare, and farmers are more likely to trust them. And a lot of times they're out there on the farm. They're right there beside that farmer. So I 100% agree with that, Cheryl. And I don't know the backside of if we are starting to work with veterinary groups, but I know that I've heard the same thing, that, yeah, we need to start reaching out to them.
So interestingly, a great point, Cheryl. At that conference, there was some pork checkout folks that were going to Wyoming to talk to swine veterinarians out there, kind of towards the western region. And so they were going to be sharing the depopulation resource as well as this webinar that's coming up. And you're exactly right. Those vets are on the farm, which that's, you know, the most comfortable place for a farmer to be is on his farm. And then they are rubbing elbows right alongside of him, talking. It's easy to lead into conversation because you're talking about the animal welfare, where the prices are, what are those medications I can give to help my animal to achieve health, and all of those things that go into that industry, that the perfect folks, right, to talk about. Let's talk about your stress and how are you doing, and then to have that swine producer to have in his pocket those tools. Like, I really would like you to connect with a local resource to help you.
All right. And I am going to share in the chat that webinar if you aren't able to get the QR code there. But if you have any other questions for either Cheryl or Linda, feel free to go ahead and unmute. We love interaction. Or if you can't talk, definitely go ahead and put it into the chat. And then we'll bring it up here. All right. Everybody's quiet on this first day back at work.
They're looking at their emails going, oh my gosh. Got some work to do.
All right. I have just added our homepage has a calendar on there, and hopefully I put it to events so that you can scroll down and see all the webinars that we have upcoming. But that the one that Linda just shared is on there on, I believe, the 13th is what it said. Abby says in chat, she says the veterinary organizations are heavily involved in mental health of veterinarians. One important thing to remember is that while veterinarians are often look to care for their clients, yes, they need to be able to care for themselves too. Yeah, we have had discussion about that as well, like trying to get in and teach QPR to like the vet schools, maybe their conferences, something like that, because they are often very overlooked. And as you guys probably know, working in the agriculture community, more of that is coming to the surface, where we are seeing veterinarians, even though they know everything, you know, about how difficult it is to be a veterinarian and all of the animals that they have to put down, they actually get to a point where it is so traumatic and heavy on them that they are ending their own lives. And I don't think any of us really put into perspective how difficult of a position that they are always in, because they are watching, whether it's a loved, animal that it, like the pet, and they're having to put them down with sobbing, family members in the room, or, like if the swine flu or fever comes through, putting down an entire herd, or, just an entire barn of animals going down, that is hard on everyone. And that veterinarian has to do it over and over and over again. It's not like I'm going to do it to one, I'm going to leave. I'm going to do it to hundreds. That death is a very, very difficult thing. So I'm glad that we're finally, one, looking more into the mental health of agriculture. I think the pandemic has really helped that in many ways of bringing it forward. And we're finally saying, hey, it's okay to reach out. But veterinarians are also coming to the surface saying, hey, we're forgetting about somebody here. So great point, Abby.
Right. You bring up a lot of those that work in the industry kind of forget about themselves. They take on the burdens of the producer.
Absolutely.
And it's important that they take care of themselves as well. Yeah, I do know Pork Checkoff is continually talking about African swine fever and how they can best help. In the event there would be a depopulation, would they have a different group come in versus that farmer who has grown that livestock to that point, but having a different group come in and depopulate that maybe is not as connected to the animal.
To that animal. And Donna made a great point, just was it last year that the bird flu came through and entire flocks of chickens had to be destroyed. Same thing, it's like every year something terrible seems to happen. I'm not sure why I feel like we're on that road every year. Like we're not either getting a message or something,
Those uncontrollables.
Yes.
Right, and it's still out there because right now the wild bird population is being affected in major ways. And as long as it's in the wild bird population, we could see more of it in our domestic populations.
Yeah.
So
Exactly.
it's not over.
No.
Yeah. Not over, just being talked about less.
Yeah.
All right, everyone. We're gonna go ahead and send out an email with Linda and Cheryl's information on it if you want to contact them. I will also go ahead and put Dr. Tara Haskins and Huese's email in there for anybody's having trouble with the farm response login or having more questions. You can go ahead and email them. But we thank you so much for attending. We actually had a much higher attendance than I thought we were going to have today. So I thank you for taking the time out and spending with us. So look for the email with the recording. You can pass that on to any of your fellow colleagues. And then we always want to make sure that we thank our sponsors in Nutrien, CS Cash, and I think there's one more I forgot. Always AgriSafe. Nutrien and CHS funds our AgriStress monthly meetings. So we always want to thank them for letting us continue to bring these wonderful projects and people together to share with everyone. So until August, guys, have a wonderful July. Thank you.
Carrie, I wonder, did you want to put the link in for the depopulation resource as well?
I put in, the resource. I did not put the resource in. I just put the event in.
Yeah. Do you want to look it up, or do you want me to quickly share that with you?
I think we don't have, I'll look it up and have Quace, because almost everybody's gone. I'll have Quace put it in the email. Depopulation.
Because I've been working with Angela. I would like it at the top of the list so people don't have to scroll through all of the mental health resources we have. But for whatever reason, it wants to kind of bury itself down in the middle.
Yeah, because I had to go, find that too.
Yeah.
Okay. All right. All right. Okay. Got those written down. I'll have Quace send that out. He's on me like within 15 minutes after the meeting. If I don't email him, he's like, Carrie.
I think he gets a lot of requests throughout the day.
Right.
He tries to stay on top of them. But yeah, it is good that he is geared that way.
Yeah.
I agree. I agree. I feel like there was something else I wanted to ask you, my dear. Hey. Not coming to me.
Let me see real quick.